morning, everyone, and welcome to Let's Talk About Head and Neck Cancer. My name is Tara Gannon, and I work at Western and Central Melbourne Integrated Cancer Service, or WCMICS for short. We work with hospitals and people affected by cancer across the western and central suburbs of Melbourne. It's really lovely to see some familiar faces from the event that we hosted in July, but also a very warm welcome to all of the new faces here today. And also a welcome to those people who are watching a recording of our event retrospectively too. I'd first like to start with an acknowledgement of country. I would like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to them and their cultures and to elders, past, present and emerging. So today I want to bring the spotlight to head and neck cancer. Whether it's been yourself, a family member or a friend affected by head and neck cancer, we all know that there are so many good reasons to bring us all together today, and I think the wonderful attendance today is very true to that. As you will have seen at the back of the hall, we have quite a few stalls set up covering many different areas. So the back left, we've got Daniel at the virtual reality stall, so you're welcome at the lunch break to have a go of that. We've got Bryony here from Cancer Council Victoria. We've got Nadia from BeyondFive. And we also have many nutrition and swallow stalls, oral health, and so there'll be more time for you to visit the stalls, have a chat, perhaps get some information, ask a question, or even find a product that you might find helpful. So in organising today, I met with several people who have been affected by head and neck cancer themselves and who will be kindly sharing their experiences with us today. So we have Lora, Deane and Andy here with us. Our first speaker, I met Lora during the event that we hosted in July, and she bravely shared with me when we caught up about her experience of surgery and treatment for stage 4 tongue cancer and all of the real-life moments in between. She shared her story at the Victorian Comprehensive Cancer Centre at the start of the year, and we're so grateful to hear from her today. I'd like to welcome Lora to the stage.
Hi, my name is Lora Winter. On the 5th of April, around 7 a.m, it was the last time I was able to say my name. It was to a lady on the admissions desk at Royal Melbourne Hospital. If I truly understood how drastically my life was about to change, I wonder if I would have done anything differently in the lead up to that day. In January 2017, I noticed that I had an ulcer under my tongue. No big deal, I thought at the time. I was a working mum with 2 children under the age of 4. We had just started building the house and preparing to put our house on the market the following month. Oh, and I'd lost my wedding band at the beach a few days before. Ulcers were caused by stress, right? But weeks went by and the ulcer didn't go away. It seemed to not change at all, yet was really sore when I spoke for long periods of time. Our house was now sold and our eldest son had just celebrated his 5th birthday. So I decided, with the encouragement of my husband Paul, to go to the GP to have it looked at. Wednesday was a non-work day for me, so off I went. It was then on the 15th of March 2017, with my 5-year-old on the seat next to me and my 2-year-old on my knee, that my GP blurted out, "That looks like cancer to me. I want you to see a specialist straight away." I met with Mr. Tim Ozali, who took a biopsy and asked to meet me a few days later at Royal Melbourne Hospital. With the team he was going to assemble. The initial biopsy was showing that the cells were starting to change, but that was about it. Tim and the many others that I saw that morning were pretty certain they were looking at a cancerous growth. So they agreed to go in the following week to do a deep biopsy so he could do a CT. I guess the initial results should have made us feel hopeful that we were dealing with a stage 1 tumour. But when I went back to see Tim for the results, a few days later, he delivered the news that wasn't the case. In fact, it was stage 4. So it was all systems go for the operation the following Wednesday. I went home and recorded all the boys' favourite bedtime stories so that they could hear my voice, so I could still be heard even when I was in hospital and not there to put them to bed. I'm glad that I did that, but the truth is, hearing my old voice makes me quite sad now. Not that I loved my voice before, but I loved the ease of that speech. I told Paul that while I had the tracker in, I didn't want the boys to visit me in hospital. I know that Fiona Constantine from Royal Melbourne did question me on that several times during my stay, but I stood by it and knew then, and still know now, it was the right choice for me. The day of the operation was my easiest day, but the hardest day for Paul and our families. It was a 14-hour operation. 2/3 of my tongue, along with the floor of my mouth, was removed, and the free-form flap was created from my left inner forearm, including removing a vein and artery and a skin graft taken from my left thigh. My lower right teeth were all removed, along with 5 millimetres of my jaw. The average time for recovery is 10 days. I bucked that trend. I remember saying to one of the nurses at the time, it felt like somebody was sitting on my chest and I was finding it hard to breathe. And that was the start of it, I think. On day 8, I ended up with an infection and needed to be taken back to surgery for a washout and another portion of tongue removed. I felt like I'd gone back to the start all over again. The neck veins went back in and I felt I'd be in there forever. Probably around this time, when Fiona was trying to encourage me to get Paul to bring the boys in for a visit. The reason I didn't want them to visit while I had the tracker in was because I didn't want to see the fear and panic in my baby's eyes. It's hard enough to see it at any stage, but to see it and really not be able to console and comfort them is unbearable. I knew that them not seeing me was much harder on me than on them. They were having a ball, being spoiled by their grandparents and aunts and uncles. Sure, they would ask about me, and they missed me, but they knew I was getting better, and that made me push through. The most painful part of the operation was always my donor site. It was very painful. And when the dressing first came off, I physically felt ill. To see my body so broken was so shocking to me. One night, my trachea got blocked, and that was truly terrifying. I have never been so terrified. As amazing as the technology is, I hope and pray I never need a trachea again. The suction is awful. The half up and down process fills me with anxiety, and it is truly a terrible feeling. The half down is weird, this rush of air that makes it hot and splutter. And you can't regulate your breath without concentration, and I mean really concentrating. You've been doing it literally every day of your life without thinking about it, and now I have to focus. I have to stare off into space so I can focus without going into a shopping tip. Being able to smell again is also a weird feeling, although, to be honest, sharing the room with CNN, the smell part was something I should have done without. Then you watch the time ticking by, and you know they're coming to put the house back up. In the start, you almost run through it, because the concentration is exhausting. Towards the end, when you're itching to get home, you start to dread it. When they put the house back up, to me, it felt like glad wrap going over my face. It felt suffocating. After 22 days, I got the trachea out, and what a day it was, and how easy it came out. I messaged Paul and said, after you finish birth, pack up the boys and bring them in. And in they came. James, who was 2.5 at the time, came in, and said, "Mum, where have you been?" He climbed onto the bed and onto my lap and couldn't care about the tubes and wires at all. He was just happy to see me. BeyondFive was different. He was hesitant to come close. He could see that I was battered and broken, and he didn't want to touch me. He was fearful he would hurt me. He was confused, but it was the best to see them, and it was the best to let them know I'd be home soon. I got home from hospital on April 29, and 2.5 weeks later, I was off for my first round of radiation at BCMICS. This was where I met my next set of amazing people. The people who for 5 days a week for the next 6 weeks would welcome me with a smile and compassion as I watched my body bend but not break while it did its best to battle through 30 rounds of radiotherapy. I think it was around day 20, and it had really caught up with me. I was tired beyond my wildest dreams. The inside of my mouth had broken out in burns, and I felt broken. I was tired. I was so tired, and I remember sitting in Liz Hughes' office at the clinic, and he asked me, "How are you today?" I burst into tears and said, "I am so tired. I am just so tired. I want a feeding tube." I'm sure it was the same thing that he and Albert had seen over and over and was trying to warn me about. But like all of this, until you live it, you really do not know it. Looking back now, I realise it took me a long time to understand what I'd gone through was permanent. During recovery, it's hard to get your mind around everything, mostly because you're battling from one hour to the next. Then it becomes one day at a time, and then weeks start to pass. The first time it dawned on me was within a visit with Reese. I asked him if I'd ever eat normal food again, and would I be able to go out to a restaurant for a normal meal. I remember being so naive asking this question. I believed he'd simply entertain me with an answer like, "Of course, just give yourself time to recover." But instead, he said, "I think you'll choose a restaurant based on the menu and what you can eat off the menu." It was a slap of reality that really knocked the wind out of my sails. He wasn't trying to be cruel, he was simply telling the truth. And it was the truth deep down I knew I'd not stopped to absorb of what that really meant for my future. The boys are 7 and 5 now. They don't remember me pre-op. They have no memory of my voice before the operation. When they hear my voice on videos on my phone, they think it's their aunt, my sister. The first time they told me this, my heart broke a little. I'm sure we've all been in that situation. Little things pop up and break a small piece of us inside. After a few days of wallowing in this sadness I felt, it occurred to me on one of my many sleepless nights, does it matter? They don't remember my old voice. Of course not. They were 5 and 2. But they do have me now, and yes, my voice is strange and altered, but my arms and body work fine, and I am able to be here to make more memories with them. And that's what matters most. And that's why, when I was given my diagnosis, I had to fight so hard. We have an army of people loving and supporting us and believing in us. But if we don't believe in ourselves for this fight, well, the battle is all but lost. The anxiety of every scan, every test, the pressure I feel that we place on ourselves to make sure that they come back clear or okay. And then there's the pressure we place on ourselves so that we don't let our families and loved ones down. It's a load almost too heavy to bear at times. I do wonder if it will be that way forever, or if it will ease over time as the years bridge it out between diagnosis to survival. I guess time will tell. The concern and stress this awful disease places on our loved ones is crushing to watch, but it's out of our control. There are no words we can offer to let them know it will be okay, simply because we do not know ourselves. There are people we have crossed paths with, the many nurses, surgeons, consultants, whoever they were. They are the person that let us breathe again. Not the lights. I don't think I'll ever the lights again. But that person who lets you know you're safe, in safe hands, and that they are in this fight with you, and you feel confident enough to let the exhale of that breath you didn't even know you'd been holding on to. We all have different motivators to get well, to keep moving forward. Whatever they are, whatever it is, that is your motivation. It doesn't matter. It just matters that we get up and keep moving forward. I have had, as I'm sure we all have had, those moments, days and weeks, where it's too much, too hard, too overwhelming to find that way forward. Those moments that we fade our old life, our easy life, but it's gone and it's not coming back. Nobody ever asks, maybe because they're too polite, too scared, too unsure of the etiquette. But whatever the reason, nobody ever asks what I miss the most. Maybe if I had have asked myself that question clearly, I could say that those moments are the ever miss. Of course, there are the obvious, like eating and drinking with ease and without thought. But for me, the less obvious ones are, I miss licking my lips when they are dry. I miss being able to mop up my son's melted ice creams. I miss talking for hours on the phone with my sister. I really miss those chats. And for months after the operation, I miss being able to kiss my boys. That one was literally heartbreaking. Why didn't I know that would happen? It would be easy to fall into a poor me thought pattern, and I have had a number of days where I just can't believe how this has happened. I'd never heard of this. I'd never heard of somebody having a cancer like this or the operation. It would be easy to feel sorry for myself. It would be easy for people to feel sorry for me, but don't. Give me compassion. Give me time to do things, as it does take me a little longer. But you don't need to feel sorry for me. I'm actually very lucky. In the past 2 years, I've reaffirmed what I have always valued and enjoyed. My family. My family have always been my number one priority. And whilst people have told me I am brave, inspiring, or amazing, I don't think so. I am almost certain anyone who faces this challenge would do so in the same way I have. You do whatever it takes to be here with your children, to be here with the love of your life. There's nothing good about cancer. It's a lie to say there is. I wouldn't ever choose to be in this situation, but I am. What I can choose, though, is to find the positives, to focus on them, to find the happiness and the laughter and focus on that. I have always believed life is what you make it. People don't make you happy. Situations don't make you happy. You find the happiness in people and situations. So I've carried that forward with me during this whole utterly bizarre and surreal experience of cancer. Recently, an old workmate asked me what was on my bucket list, and the question made me stop and reflect for one moment. I had an answer for him within seconds, but it made me reflect. I'm a lucky person. I'm lucky to have this awful disease, but lucky it was found. I'm lucky to have an amazing surgical and recovery team. And lucky that I've been able to travel the world and experience travel as both a single girl and with my husband, the love of my life, and travel with him and our beautiful boys in later life. Lucky to have wonderful friends and family and have challenges and people who challenge me every day. All of this made me know for sure there was only one item on my bucket list, and that is to see my boys grow into happy and confident men. Life is short. It's always too short. Most of us here today know that firsthand. As the saying goes, Don't count the days, make the days count. Thank you.
Thank you so much, Laura, for sharing your reflections with us today. It's definitely left me feeling very inspired. Our second speaker for today is Deane. Deane was introduced to me by Dr Sien Fua, who spoke of Deane's willingness to do as much as he can to give back following his diagnosis in October 2018. This year, Deane was the Royal Melbourne Hospital Dry July Ambassador to thank all the doctors, nurses and staff at the Royal Melbourne Hospital for giving him a second chance at life. He's also been taking the time to speak to patients and answer their questions before getting a laryngectomy, a surgery which involves removing the voice box. I'd like to introduce Deane to share his story. Thanks, Deane.
Good morning. In the words of Henry VIII to each of his wives, I'll try not to keep you too long. Now, firstly, I was having a pretty normal life, and basically what happened is I started to have trouble swallowing food, and I started to get a very raspy voice, and I thought it was just hay fever and things like that. But anyway, to cut a long story short, it did turn out to be cancer in the back of the throat. So what then happened was I went and saw a specialist, and I had a debulking, which enabled me to breathe, because I was really struggling to breathe at this time. And actually this happened, I was diagnosed in September of last year, and I was informed that I wouldn't see the end of December and that I would have choked to death. So off I went. I had a biopsy, which was fantastic because it would enable me to breathe again, and it did restrict me with some eating because acidic food was quite harsh to swallow, and red wine, unfortunately, with the tannins, became very difficult, which upset me greatly. So anyway, after the biopsy, I was put into the Royal Melbourne, and I met all the team and went through the whole episode. And in October last year, I had a laryngectomy. My diagnosis probably wasn't very good before that. But thanks to the work of all the team at the Royal Melbourne and also at Peter Mac, which Lora has touched on, I've been very lucky to come out the other end. Tim Azali, who Lora spoke about, was absolutely fantastic. And he's when I say a lovely man, I don't mean that from a bloke crush type thing. He is just a wonderful human being. As were his very able assistants. And one chap who's not with us anymore was a great comfort to me all the way through, was David Rowe, who was sensational also. So anyway, so I had the operation, and then was off to Peter Mac for 6.5 weeks with radio and chemo. And as Laura's touched on, it's pretty confronting with the radiation, especially as Lora would have been on a feeding tube, because you just can't have a glass of water before or after treatment, and it does get very dry in the throat. But anyway, we got through all of that eventually, and there were some very dark periods. But I had great support from my wife, because a couple of times there, I just thought, I'm not going through with this. I can't do it anymore, because I was only given a 30% chance of getting through all the treatment. And I kept thinking, why am I doing this for 30%? But I saw the disappointment on Maxine's face, and I thought, I've just got to try and keep going. And I did, and I'm glad I did, because it's very easy to quit. And it's a lot harder to keep going, but sometimes you've just got to pick up that slack and you've got to do it. Because once you quit, you don't get another chance. So you have to go through quite some traumatic times. Now, during all that time, I must pay great thanks to all the speech girls, and both at Peter Mac and at Royal Melbourne, because they were the people who gave me so much confidence. They believed that I'd get through, and they believed in me, and that I would talk again when I didn't think it would probably happen. But they just persisted, and the smiling faces every time you went to an appointment were just so comforting and uplifting. And on top of that, we also had Tim Azali telling me not to worry about percentages and that the 30% would be proven wrong. And it's very interesting. When I did finish all the treatment and I had the PET scan and I got through, one of my speeches did say to me, because I was a bit surprised that I did get through, because I was looking, I thought, if I get an extra 6 months, this is a bonus, and I would have been happy with that. But when I got a clear result on the PET scan, I remember walking out of the rooms. I did a Toyota high kick in the air, which I didn't I, Max? But one of the speeches did say to me, somebody has to make up the 30%. And you've got to look at that. And that's the way you've got to think of things when it gets tough, because somebody does come out the other end. And you've got to make sure that's you. It's the most important part. Now I'm sort of back doing most of the things I always did before at the operation. Although, I must admit, I was doing lots of them during treatment. Even with the gastric tube in and having the radio, I was still going around to clients' places and doing gardening. As difficult as it was, I forced myself to do it, and I found it very therapeutic. And that's the sort of, you'd come home and you'd be a bit tired, but you felt better because you'd got out there and done something. You hadn't just sat around the house all day getting cabin fever. So I'm back doing all that sort of thing again. When I eat, what used to take me 10 minutes now probably takes me 40 to 45 minutes. And I have to, chew up very, very carefully and swallow very carefully. But I'm still able to do those sorts of things, probably under a lot more difficulty, but it's just nice being able to taste food and, more importantly, to wash it down with a glass of red wine, which is the most important thing, although you do need some water as well. Just in conclusion, what I'd like to say is, anybody who's going through this or has been through it, never, ever lose your sense of humour. The most important thing you can have is a sense of humour. I remember before the operation, I actually had a couple of T-shirts made. I can't tell you what was on one of them, but the other one had, "I'm not dead yet." And I wore them with great pride, and I still do. But I can't tell you what the other one's got on it because it's very rude. But that was before the operation. The other thing I'd just like to touch on is whatever you did before, or whatever you do before you were sick, you've got to go back and try and pick up the pieces and do things again. You won't do them as well, but you will do them. And it's so rewarding that, okay, things are a little bit slower, but you do get through. And if you think, as Lora said, woe is me, we had a little chap across the road, and I didn't know this. He was, I think he's only about 3.5 max, 18 months he's been treated for leukemia. And you see that little bugger run around, you wouldn't think there was anything wrong with him. And there he is, 3.5, and he's been through an ordeal like this. Whereas I've had a life, I've lived a life. So you've got to remember, there is always somebody worse off than what you are. And I'd just like to touch on a film that I saw years ago that did give me a bit of inspiration to get through this. And was based on a true story and was called Champions. I don't know if any of you have watched this film, but it's about an English jumps jockey called Bob Champion and a horse called Altaniti. And to condense it a little bit, basically the horse broke down when they were aiming it for the Grand National, and it had to go out into the paddock. And at about the same time, Bob Champion was diagnosed with cancer, and they told him he'd never ride again, let alone probably wouldn't make it. John Hurt played the lead role in this, and anyway, he went through all his treatment, and cut a long story short, he had a lot of downs, but he kept pushing, and he kept pushing, and he achieved riding a horse again, even though when he first started off, he had no feeling in his hands, of course, and he couldn't hold the reins, and that was really hard for him. But he persevered, and he got back, and he rode again, and he rode over jumps. And at about this time, Altaniti's leg problem had been fixed up by being in the paddock for quite a while, and they brought him back into work. And Altaniti, with Bob Champion on him, won the Grand National. And that is a true story. And just a little aside bit, he actually married one of his nurses, and it is a true story. So if any of you get a chance to watch that film, and it did come out in the 70s, grab it and watch it, because there's a great, great story behind the whole thing. And I know a few of you may not like horse racing or jumping. Just ignore that and watch the message that's there. Anyway, on that note, I'll leave you. Thank you very much.
Thanks very much for sharing, Deane, and always with a great sense of humour too. So for now, I'd like to invite our panel members. We're going to have a question and answer session, so we'd love to take some questions from the floor. So if you can start thinking about what question you might have, I'd like to invite Lora back to the stage. Also, we have Alana Jones, the Head and Neck and Thyroid Cancer Care Coordinator at Royal Melbourne Hospital. We have Felicity McGee, I hope that's correct, the speech pathologist also from Royal Melbourne Hospital. And we have Marg Randalls-Gazadi, I hope that's correct, a dental hygienist at Peter MacCallum Cancer Centre. So welcome to the stage, ladies. So now we have some microphones floating around. Thanks, Kath. If you'd like to ask a question from one of our lovely panel members at the front, please just give, we've got the microphones at the back, give the WCMICS staff members a little wave if you've got a question that you'd like them to answer. We'd love to hear from you. Has anyone got a burning question? Any hot topics? Otherwise you're going to have to hear questions from me. Deane, have you got a question for one of the wonderful ladies? Or even a comment? Everyone's being shy today.
Can I say something from
course you
our
can.
perspective in dental? Am I on?
Yes. Yep, you're on.
I'm Mug, and I'm in the dental unit at Peter MacCallum. And one thing we say in our department is radiation is the gift that keeps on giving. And you know your side effects will continue for the rest of your life, particularly your dry mouth, and that puts you at great risk with your dental health. So I implore you to see your dentist regularly, to use high fluoride toothpaste, which we would have discussed with you if we saw you, and we're here today, so please come and chat with us. Because one thing you don't want, what breaks our hearts is when we see patients return, their dentitions have failed, and it's so unfair. It's so unfair. You've been through enough. But if we can support you through that and try and maintain those dentitions, we're here with the advice to help you with that. You've just been through so much. You don't need that as well. Yeah.
There we go, first question. We'll just grab your microphone 1 sec.
It's not a question, but you were my dentist and you told me about your journey. And I just want to say, people like you impact our journey so much. And you were just fantastic. I was so scared I had to get my 4 wisdom teeth taken out. And I remember your face, and I remember we were laughing about cancer, and we were like, this is the one place in the world where we can actually laugh about having cancer. And I just want to say that it really eased me, and you've got a face that I'll never forget.
Thank you very much. That's incredibly kind. Thank you. I know we are a bit naughty sometimes in dental oncology. We do say terrible things. Yes. Thank you. It's incredibly kind.
On that note, any other... We've got one... No, Chris is pointing. Oh, here we go. Ian at the front. Thanks, Dillu. Ian, there we go.
I'd like to ask a question. I haven't read the whole book yet, but what do you call cancer that starts within the right ear and progresses out of that? There's a bit in the book that says outside the ear, but doesn't refer to anything in the inside the ear.
CN? Get a surgeon to answer that.
He is here, poor Sia.
Yeah, I know. I'll get a radiation oncologist to answer your question, Ian. Sorry.
That's okay. I'm just wondering, are you talking about the type of cancer or the location of the cancer?
Ian?
Are you talking about the actual type of cancer or the location of the cancer?
The location started in the right ear and progressed into the cheek.
Okay. And it was inside the canal?
No.
It was just on the ear itself?
Inside the skin, because when they operated in the ear, folded the skin back, took what they wanted to take and stitched it up again with 167 stitches.
I would be taking a guess, but that canal part is called the external auditory canal, and the most likely would be a squamous cell cancer, which is a typical skin cancer, and it tends to do that. It tends to spread to little glands within your parotid gland, and that needs to be removed at the surgery, which results sometimes in weakness in the face.
There we go. Thank you, Cian, for stepping in.
Thanks, Cian.
We've got a question just in the middle from Mike.
About question. Who in the room can help us get an emergency care program together for laryngectomies? And the reason I ask the question is we have a sticker in the car which says a neck breather. The majority of medical people don't know what a laryngectomy is. They all think it's a tracheostomy. No emergency services have ever been trained for paramedics and fireys. I know this to be true. It's a bit of a problem because if you're in an accident and someone doesn't read your smashed windscreen sticker with the neck breather, or as one paramedic said to me, I'll put my thumb in your throat and give you mouth to mouth. I said, that should kill me in a few minutes, you'll be right. We can all laugh about it. I've had a laryngectomy for 2.5 years and so have a few other people in this room. It's a bit of a worry when you go into hospitals and medicos don't know what a laryngectomy is. What can you do as a group to help us get exposure for emergency care
through the medical fraternity and the associated services to help us survive.
Felicity, you might be the best person to answer.
Alana
or
and I
as
are
well.
best to answer that. I fully appreciate the frustration there. I think the way we've tackled that over the years has been a little bit ad hoc, and some hospitals have better guidelines around managing people when they come into emergency centres than other hospitals do. There have been pockets of training up ambulance staff, but it hasn't been consistent, and I think we can do better there. Probably the bigger hospitals that are undertaking laryngectomy service will be more aware of what they're dealing with when you come through to emergency and having any breathing troubles or how to manage your airway. Smaller hospitals that are not performing that surgery at the site often struggle with it, and if it's out of hours, are calling major centres to get advice on it. So I fully appreciate the challenges around that. Speech pathologists are often involved in trying to help upskill emergency departments, but it's an ongoing battle for us as well, and something that potentially the head and neck cancer, the laryngectomy association and the Victorian Head and Neck Special Interest Group for speech pathologists, something that can be worked through there.
Theoretically, you're correct, and I appreciate your feedback. The reality is that most of us have gone back to the same hospitals that we've had our laryngectomy. Emergency staff have no idea what a laryngectomy is, don't know what a voice prosthesis is, so it may be correct, pockets have been done. We haven't come across it, and I'm talking very generally. I was involved with the association.
Yes.
We now have a group of Larrys and we discuss these issues. And we're trying to get to the bodies that can help to make these things happen, because there's been not a lot of progress in the last couple of years.
Yeah, I think there was a big push on getting emergency management posters and education material up in emergency departments probably about 10 years ago. And potentially that has dropped off the radar a little bit in the last 10 years. So perhaps it's time for a refresh on staff and boosting awareness in those departments. We should also be asking your clinicians to make sure you've got an alert on your medical file that says you're a neck breather. I know that's one of the most important alerts that our patients at Royal Melbourne can have on their file if someone either has a tracheostomy tube or is a neck breather, and that actually flashes up as a major alert for you when you come in the hospital. So that could be something to encourage people to make sure they've got on their file.
Thanks, Felicity. That's wonderful. Thank you.
I live in Gippsland, and I quite often visit Warrigal Hospital. Now the head surgeon, the head doctor at the emergency department walks up to me, shrugs his shoulders and says, "What do I do?" My wife's got to give him a phone number.
Yeah.
I've also been to Casey Hospital where I've walked in the emergency department there, and I've come across a nurse there that had a big sign on her dress that said respiratory nurse.
And she doesn't
"What's
understand
that?"
it either. Yeah.
I had to train her into treating me before I could do anything. That's our problem. That's our major problem.
Yeah, I know some of you might have had your surgery a number of years ago, but the other thing that the speech pathologist will sometimes do is actually, if you're going back to a more regional centre, is actually set you up with a booklet that outlines exactly what the changes in the body systems are and what to do in terms of cleaning that area and emergency management of that area. So that can be handy if you go into hospital and you're having trouble communicating. You hand them your booklet and say, "This is it. This is me." It's like a 6-page booklet that shows all the diagrams to say what what your anatomy used to look like, what it is now, and what the risks are, and most importantly, big highlighted sections on there saying, never cover my neck.
That's okay if I'm conscious, but I've got one of those books. I've already made one up.
Good.
But our main problem is getting the information out to ambulance officers and emergency staff and people like that. And anaesthetists, yeah, I've had arguments with them too.
Yeah.
Yeah, that's our main problem. That's what we've got to try and do. Yeah.
Yeah, definitely appreciate that. Yeah, we do have challenges with that, even in the bigger hospitals. But I think the Laryngectomy Association have done some good work with ambulance in the past, and perhaps it's time to revisit that.
It's way past time.
Yeah.
Definitely a work in progress. Thank you. All right, would anyone else like to wave their hand and ask a question?
Hello, it's Kathy. I'm right at the back. I'm here with WCMICS. Please don't turn. I'll just talk to the backs of your head. I'm taking some notes because one of the unique things about who we are is that we're one of 9 across the state. We don't deliver cancer services, but we work with health services and the Department of Health to try and, improve processes and improve, ultimately, patient outcomes. So I'm taking some notes because I think that's some really interesting feedback, perhaps for our regional colleagues, that might be an opportunity that they could work through with their health services in terms of addressing laryngectomy care or something like that. So whatever's said here today isn't falling on deaf ears. Where we can, we'll try and action or facilitate or link in so we can make some small improvements or process changes to help out.
Thanks, Kath. There we go. Good question from Nadia.
Hi, I'm Nadia from BeyondFive, which is the head and neck cancer charity. It's one for Lora, or any patient here really. What information would you have liked to have known when you were diagnosed to have made this whole process easier for you to have managed?
I have thought about that a fair bit. I don't know, I think that's a hard one because sometimes I've found everything needs to be in bite size. So I was probably given an awful lot of information at that first consulting moment of what was about to happen. But what you hear and what you process are very different. So I think I needed to understand my food intake was forever going to be compromised. And I didn't understand what function the tongue played in our lives. I've never thought about my tongue at all. The only time you ever think of it is when you bite it and it hurts. So I never realised how it played a major role in our speaking, eating, drinking. As I said, I didn't even know hissing, my breath would be affected. So I think if I understood the function of the tongue, it would have helped the other pieces fall into place without somebody spoon-feeding me that information. So I think, I just needed to understand the role, and I think in the medical situation, doctors and consultants, that's part of their everyday. So it's not necessarily something they would stop to explain, and it's not a question I would have thought to ask either. So, and I think if I had that information, that's all I'd need. So, yeah.
Thank you. Anyone else? I was just thinking on that, Lana, you probably see that when people have been recently diagnosed, almost that information overload and knowing when's the right time to get information to them.
It's a balancing act because we tend to, a lot of people, you have to address each patient individually. Yeah. Some people want to know a lot, some people don't want to know anything. and sometimes you can barely get out the word trachea and they're like, okay, that's enough.
Yeah.
And so it's difficult because we need to focus on immediate post-op just in their workup, because there's so many changes post-op that is more the immediate focus. And I agree with Lora, like, I do think we don't focus so much in our nursing education. I don't know what speech, probably touch on it a bit more, but we do struggle.
Covered in the speech pathology pre-surgery education session, but that can happen within the first 2 days of someone being told that they've got cancer and they're needing to have this huge operation, and there's so much information coming at people at that time. Your ability to take all of that on is really limited, I think.
Yeah, and because it is such a time-critical surgery as well, it's very, it's a balancing act getting the information out there.
Of course,
Definitely.
having just the right amount at that point
Yeah.
in time. And I know for
And
Lora,
each patient as well.
it was only 2 weeks between diagnosis and your surgery as well. So
And that's quite common.
That's a reasonable amount of time. It can be much shorter than that. And it's true, Alana. We'd often have people that, for them, knowing less at that point is actually more helpful for them, because it's distressing for them to hear too much information, and other people want to know absolutely everything and all the details, and that's what they need to get through. So everybody's really different in how they approach it.
thank you. And I think just again to comment, at the July event that we hosted, we had a bit of discussion around Dr. Google. I wonder if some of the panel members can comment on what their maybe experience and I guess the importance of pointing people towards reputable information sources as well.
If I can get in there quick enough, I will say stop, don't Google.
It's just human nature sometimes.
When I first meet patients, most of them have had the diagnosis, so often people are Googling the specific cancer, which I find I don't think it's very helpful to them to look up that they've got a squamous cell carcinoma. I think that's, it's not important in the scheme of the surgery and the treatment that's going to be required. I give every patient the Cancer Council booklets and the contact number for a nurse, and I give them all a BeyondFive thing as well, and just because the education session is a lot. It's a half day where they're meeting everyone, and I say, go home, take it all in, and then if you're thinking about it again, the Cancer Council and the BeyondFive information is very good at, it's catered for patients, and it's not in medical speak, so I think they're great resources.
Fantastic, yeah.
So I say no Googling.
Yeah.
And then they all say too late.
The other thing I'd add there is that the head and neck area is so complex, and whenever someone comes in with a cancer in that area, the treatment they're going to require is so unique to that one person. There are so many important structures in that area that it's really hard to find someone online or by Googling that's got exactly the same problem that you're presenting with. So you can't really match up online that easily. It's probably best to go through your surgeon or your multidisciplinary care team and find someone who they know is going to have a similar outcome to you.
Definitely.
And from a dental perspective, I'd be questioning your dental care providers. Do they understand what the side effects and ramifications of having radiation to the head and neck are? Have they been to any information sessions? We are, our department, trying to get out to places and educate dentists at the moment. I was in Wangaratta on Tuesday. And if they've got, and the dentist is unsure, or they're giving you a treatment plan that just seems ridiculous, get in touch with us. Get in touch with us and get us, we'll talk to them, or come in and say, can I have a second opinion? We can't do that all the time because we're very busy, but just make sure they understand and they're not trying to upsell you ridiculous amounts of treatment that you don't need. You just need a damn clean mouth and a lot of fluoride, Yeah.
That's great. We've just got a question at the back.
Hello everyone, my name's Janet. I'm actually a dietitian and I know of this support group and I thought I'll pop in and see what's happening. I work in the field of oncology, both in a private setting as well as in a public regional area. Thank you so much, Lora and Deane, for sharing your story. It's very brave of you to step up and share that. And from the picture and from part of what you've shared, it sounded like, you know, you've got enteral nutrition support. Some of you may not be familiar, but that could be a tube that supports nutrition while a patient's having treatment. And we've mentioned about how there's a lot of information at the start of diagnosis, and part of that would probably have been discussed. And I trust that, you know, you've got a good amount of support throughout treatment. But what I'm interested to know is about post-treatment care and support. As we know, food plays such a big role in our life. Do you feel like post-treatment could be the side effect of the treatment, and that you're still wanting some information about diet? Do you feel like, you know, that's something that you're getting support for?
Definitely. I know that I met with Lisa after might have been during radiation. Met with Lisa, and honestly, if I hadn't have met with Lisa to go through what my body needed to rebuild, and it is really hard because once you're off the feeding tube, for me, eating is still really hard. So it's fine to say you need your protein, you need your vitamins, but trying to have that in a two-layered dish might not be so appetizing. And your taste changes as well. So for me, salt is, for a while, felt like someone had put chili in there. So I couldn't have salt added, and anything tomato-based as well, and then that started to change. This opens more doors for better options. I'm now able to have normal-ish foods. It does take me a lot longer, like Deane had said, but it's easier to have the protein. It's just ticking off what you need. And in between, I had the supplements of resource as well. So
fantastic. I assume Lisa is your dietitian?
Yes, down the back.
Okay, hello. That's fantastic, and that's the care that you got through the health service that you've got your treatment. And for what period of time were you getting that support? Is that ongoing?
In all honesty, I had Lisa's email address, and if I ever had if I ever had a question, she was always there to answer it. So I only met with her face to face. I think it was every couple of weeks as a weight check-in to make sure that I wasn't losing too much weight during that treatment process. But after that, it was, if I had questions, I just went to her for the I don't know if other people do that. But I would just email Lisa and ask. So.
That's good to hear that you're so well supported.
Yeah.
Thank you.
And sorry, just to finish on that note, if for some reason, maybe if you work in the private space, how would someone be able to access, if they needed to see a dietitian privately, if they weren't at a tertiary hospital, perhaps in a regional setting as well?
Yeah, thank you. So our body's called the Dietitian Association of Australia, DAA, so that's somewhere that you could jump on and find a dietitian. There's a method there, and I guess, you know, linking in with your GP or even with your specialist, if that's something that's of concern to you, definitely voice it up and make sure that you get some expert opinion on that. What worries, apart from Dr. Google, there are other people who may not be very familiar with the condition and may suggest things that might actually work against the treatment plan that your specialists have planned for you. Some high doses of vitamins and minerals may not be appropriate at certain phases of treatment, for example, and that's all very individualized, and speaking to an expert would be the best.
Fantastic, thank you. All right, if there's no last minute questions, we do, just one.
I was just going to say, or just ask, I was curious, I mean, it's such a complex disease, and there are, limited English resources. How do the clinicians go with communicating to your patients from non-English speaking backgrounds?
Interpreters at the hospital. I also touch base with speech, who will see them pre-op. Immediately post-op, if they're unable to write in English, we try and get a communication board, whether it's just pictures or while they've got no voice and got a trachea in. It definitely is difficult. Most people can come through with a family member who does speak English, but we don't like to use them as the interpreter. But yes, I'm not aware of any resources that are not in English that I can provide.
There are a couple of key resources that we would use regularly in speech pathology that are translated into some other languages. So things around diet modification, so people needing information on pureed or mince type diets, those sorts of things, and also some laryngectomy education as well has also been translated into some of the other more common languages in Victoria.
Yeah, and we do particularly post-extraction information in different languages, which are available on the DHSV website for patients, yeah.
Fantastic. All right, last question, Janet at the back.
It's actually more of a comment to add on, if you don't mind, just from a dietitian's perspective. So I know Peter Mac done a lot of great work. I used to work with them for a bit. There's actually videos as well on enteral nutrition support and how you could manage that. And it may be in English, but I think when it's something visual like that, despite the language, people would be able to pick up some information from there. So there's definitely some podcasts around to help support patients.
And can I just say, we've added we had a session with our head and neck dietitian in our department. Many of you on supplements, and we would never say not to have them, but many of them are up to 30 grams of sugar. So we were asking in there, telling their patients now, and some of you may have missed this, if possible, to rinse with a bicarb soda mouth rinse afterwards, just to raise your pH again in your mouth, because that in combination with your dry mouth puts you at great risk of radiation caries. Yeah, by all means, you guys guide us. We would never say no. Food clearance, etc. Yep, absolutely.
Fantastic. All right. Thank you very much to all of our panel members. If we'd like to give them a bit of a round of applause. Thank you for being brave enough. Thanks, ladies. Our next speaker, Nadia, has flown all the way from Sydney this morning to be with us here today. Nadia works at BeyondFive, whose mission is to improve the quality of life of everyone affected by head and neck cancer through education and access to support, and to raise awareness of head and neck cancer nationally. Thanks, Nadia. Yep, just the down one.
Excellent. Well, it's a fairly formal, informal introduction to who we are. So I normally like to start with just a show of hands as to who's actually heard of BeyondFive. Well, that's encouraging. And who's actually had a chance to have a look at the website. Okay, thank you. A little bit about me. I first started working in head and neck cancer back in 2007 when I was employed by Professor Chris O'Brien, who some of you may have heard of. He was a head and neck cancer surgeon in Sydney, and he did a lot for head and neck cancer. He actually started a clinical society to represent head and neck cancer clinicians, the Australian-New Zealand Head and Neck Cancer Society, and was heavily involved in lobbying government for a comprehensive cancer centre in Sydney. Sadly, he was diagnosed with the brain cancer and passed away in 2009, but he employed me to manage at the time the Sydney Head and Neck Cancer Institute. And we did a lot of work, but predominantly it obviously was in Sydney, and it was to support clinicians who were working at one of the hospitals in Sydney. And I remember when I worked there just thinking, why wasn't there more information for people with head and neck cancer? Why wasn't there a charity to support people with head and neck? My dad had leukemia, and I grew up with doing fundraising constantly for the Leukemia Foundation. So it always perplexed me why there wasn't something for head and neck cancer. And so I'm really pleased to have the opportunity to work for BeyondFive. And how BeyondFive came to be, so for a couple of years there was a lot of discussion between clinicians from across Australia to set up a head and neck cancer charity. Funding was always an issue, so there was obviously a lot of goodwill and people doing a lot of work in their time outside of their clinical hours. But in late 2014, we got a really special Christmas gift, I guess you could say. A gentleman who's an expat Australian, now lives over in the UK, made a donation to a clinician who wanted to set up a head and neck cancer charity. The reason he made the donation was because one of his aunts, when he was growing up, had head and neck cancer, and he watched his mother care for his aunt, and sadly she passed away. And he always thought growing up that if he ever had the capacity to help, that's where he would like his money to go to. And that's how BeyondFive started. It was from that donation, because even though there was a lot of goodwill from clinicians, the reality was that until we had a small pot of funding, we didn't have the means to actually do the work required to put BeyondFive together. So BeyondFive is a not-for-profit national organisation, and it was established in 2014. Our website was launched in 2016, and BeyondFive, the name, refers to, I get asked this a lot, why are we called BeyondFive? And because, as everyone in this room knows, that even once you've had head and neck cancer treatment and you may have be told that you're all clear after 5 years, the side effects of head and neck cancer treatment last well and truly beyond 5 years, and it's the support and care that people need beyond the 5 years of treatment as well. We work collaboratively with people across Australia. We currently get no government funding, so as I said, we started from that donation, and since then we've relied on fundraising from general public, from corporate sponsors, and from various foundations to fund our work. So who makes up BeyondFive? At the moment, we have a board of voluntary directors. They're mostly clinicians, so we've got surgeons, radiation oncologists, nurses, speechies, and in April this year we had our first non-clinical director who, one of her cousins is being treated for head and neck cancer, and she joined us in April. And ideally what we want to do, as much as we love the clinicians, we want to move the clinicians off the board and get their expertise, but actually have a board that's filled with a diverse group of people who have the skills to really drive BeyondFive, so we can be competing with charities like Ovarian Cancer Australia, like the McGrath Foundation, to advocate for people with head and neck cancer. And our staff, we're pretty small. So I work part-time for BeyondFive, and I have a member of staff who also assists me on a part-time basis for our digital marketing. So we're pretty small. We rely on volunteers, and we have interns who help us as well from some of our local universities. So what do we do? At the moment, our goal is to provide education and access to support for people who have head and neck cancer. So our aim is to raise awareness and to educate people in the general public. There's not a great deal of understanding of awareness for head and neck cancer. So by increasing that awareness, both in the general public and even with GPs and dentists, to encourage people to get that earlier diagnosis and referral to clinicians. And we provide support to people who've had a diagnosis, and that support can go from once they're diagnosed through treatment and after treatment. And you'll notice that influence policy is not bold. That's what we'd like to be doing. At the end of the day, there's a lot of things that we'd like to do, and some of those issues have been spoken about this morning, but to make a really significant impact for head and neck cancer will require being able to influence government policy so we get the funding that other cancer groups get to support this group of people. So the BeyondFive website provides evidence-based information across the cancer care continuum. So you can go on the website if someone suspected that they may have a head and neck cancer, they could find information about what the different signs and symptoms would be and a pathway that they should follow. And through to diagnosis and then treatment and then information to support from a nutrition, oral health, physiotherapy, all the different multidisciplinary teams and information that you need. The content was developed over a 2-year period, and we had more than 60 clinicians involved from across Australia and New Zealand, in addition to patients as well, who contributed to the content and helping us put together patient videos. The resources on the website, we have more than 60 information sheets. So there's information sheets on each of the 10 different types of head and neck cancer, surgical procedures, and all the health and wellbeing information sheets as well. There are animations which go through each type of head and neck cancer. So you can see a 3D animation and it takes you through the anatomy of the type of cancer. There are patient and carer videos. There's a database which has information for all the available head and neck cancer support groups that exist in Australia and New Zealand. And we send resources, and by resources I mean clinicians, we call them patient cards. It's like a business-sized card that then clinicians can give to patients who are newly diagnosed, so they can go home, or a friend or family member can go home and can log on to the website and find out more information. In 2019, we worked with clinicians over in Western Australia to put together a podcast series, our first podcast series, where we interviewed a surgeon, a radiation oncologist, 2 nurses and a patient about head and neck cancer. And this year we also developed an immunotherapy for head and neck cancer information sheet. So how many people access our information? Well, in the last 12 months, we've had a huge increase, a 66% increase actually. We've had over nearly 47,000 new visitors to the website. And if you see there, we had 80,000 since we launched in 2016. So it's been a huge increase in the past 12 months. In Victoria, we've had 8,000 people alone just this year who have visited the website. Our 3D animations and patient videos are particularly popular with international groups, and we've had visits to those. It's over 210,000 now. We had a lot of people viewing those from India, the States, the UK and the Philippines. We send our resources free of charge to anyone who requests them, and at the moment we've sent them to well, I didn't add all of that up actually, but it's all of the hospitals in Australia who have head and neck cancer departments, as well as a lot of regional hospitals as well. So I'd be very surprised if any hospital in Australia who's treating head and neck cancer hasn't received our resources, and we resupply those free of charge whenever we get requests to do so. As I mentioned, we've got a database on our website where if there are patient support groups around the country, they have a dedicated page where they can put the details for their individual support group, and it gives them, I think, a challenge of support groups sometimes is that they're run perhaps by a patient or a clinician who doesn't have the time or the expertise to set up a web page. To have when the next meeting's going to be, when is the meeting going to be. So we provide that, a page. It's fairly simple, but it does mean that people, if they have a diagnosis, can go here and they can find out if there's a support group in their area pretty quickly and when the next meeting's going to be. So some of our highlights in 2019, we were invited just at the end of last year to become a Health Direct Australia information partner. And if you're not familiar with Health Direct, it's a government-funded, not-for-profit service. It basically is an online repository of information, reputable information from different organisations. So, say for example, if you were typing in heart disease into their website, you would be channelled through to the Heart Foundation Australia website. So we are now an official partner, which means that if someone's looking for information on head and neck cancer and they type in tonsil cancer, for instance, they now receive a link to BeyondFive. So that's helping enormously to increase awareness of the resources that we have and directing people to reputable information. We work closely with Cancer Council Australia every year when there's World Head and Neck Cancer Day. And this year we also worked with the Australian Dental Association in New South Wales on an oral cancer awareness campaign. And those kind of collaborations are essential, and it's what we strive to do, and we'll be continuing to do that into the future. We try where we can to raise awareness in the media, so we got on the Channel 10 News just recently, which is a bit of a highlight, and we get free advertising space in some Bauer Media publications, which again just raises awareness of head and neck cancer throughout the country. And as mentioned earlier, we appointed our first non-clinical director. We don't receive any government funding, so we do rely on doing our own fundraising. And for us, this year we've held 2 fundraising events. One's called Soup for the Soul, which is a little bit like Australia's biggest morning tea, but instead of sharing morning tea, we ask people to share a bowl of soup, because that is obviously a meal that people who have had head and neck cancer rely on in the months after treatment, and we know that a lot of them probably don't like soup anymore, but we have found that that's been great at raising awareness and bringing people together from their communities to help raise awareness for head and neck. We've had people raise funds for us. I've had people do the stadium stomp at the MCG this year and up at the Gabba in Brisbane. And again, not only is it raising funds, but it's also creating an awareness in the general public and amongst our local politicians about head and neck cancer. At the moment, we're working, we received some funding from Dry July, and we're working collaboratively with nutritionists and speech pathologists from several different hospitals across the country to develop some videos about maintaining good nutrition before, during and after treatment for head and neck cancer. That's been a project that we've been working on all year, and we're hoping to film that in the next couple of months. We're supported by a number of peak bodies, Cancer Council, the Australian Medical Association, and all of this has been crucial to, I guess, what's the word I'm looking for, for people to have that understanding and be reassured that the content that we provide on the website is evidence-based and it has been reviewed. So to have the endorsement of all of these groups who have recognised that there was an unmet need for head and neck cancer in providing evidence-based information, and that unmet need wasn't being filled by any government body or many of the peak cancer bodies. So they're very supportive of the work that BeyondFive is doing, and we're working collaboratively with all of them, and that's really important. We certainly don't want to be reinventing the wheel. We want to be working with people together to help and to improve the experience of head and neck cancer patients. We rely also on some corporate partnerships. And that grey section that I'd mentioned earlier, ideally what we want to be doing is influencing government policy, and there's a whole list of things that we'd like to do. I think firstly, there's a lack of information and data out there about what is the existing funding for head and neck cancer research and treatment and care after having treatment for head and neck cancer? There isn't that kind of information available for head and neck cancer, and I think there's a real need for that to happen, so we can actually then go to government and say there is an inequity of care for people who have head and neck cancer, and what could we do to improve that. There's certainly a need to educate GPs and dental practitioners, so people are getting a diagnosis earlier, they're getting their referrals earlier, to raise community education and awareness of head and neck, and including HPV awareness in schools. So parents are signing off to ensure that their children are getting the HPV vaccine. We know that cervical cancer awareness is, people know that HPV causes cervical cancer, but the majority of people wouldn't know that head and neck cancer is also caused by the HPV virus. And improve services and treatment, a national information helpline, funding for specialist head and neck cancer nurses similar to the McGrath Foundation or prostate cancer, financial support for out-of-pocket dental expenses, more information on sexual health, which is incredibly important after treatment for head and neck cancer, and one that's obviously close to the heart of Larry's in the room, but Australia-wide funding for HME supplies and improved education for emergency care clinicians to keep laryngectomies safe. So I'd encourage you to find out more about us, and if you're interested in getting involved, then please come and talk to me. We've got a quarterly newsletter that we put out. If you're a clinician or a patient, you're welcome to order our free resources. If you know of someone in your community who you think could help or is interested to help, have a conversation with us. You could fundraise for us. You can follow us on social media. There are lots of opportunities to get involved, and I think it's a community that really needs our help, and together we can make a difference for them. So thank you for your time and for letting us come along today.
We also have not just family support, but we have a lot of friend support. Who just said, look, I know your family's there, but if you need anything, call us. And we always, at first we felt strange to take people's help, but it didn't take long for us to say, we'll do that for them. At this time, we'll take any help we can get.
If you need help, it's there. And it's one of the things that makes the whole process work very well.
On behalf of the Hanks Social Group, I'd like to welcome everybody here, especially some new members who've come to join us. This is quite it's a social club, and we're pleased you can come along and hopefully can meet some friends and talk about things, but just generally relax. That's the idea of it.
Having a social group where you can be amongst people who've been through a similar thing to you and talk about it, like old war stories, if you like. It can be a really wonderful feeling, the human contact, for people who can otherwise become isolated, and can be a stepping stone into getting back into society and living more of a full life, interconnected with the people around you.
Well, the Hanks Group it was initiated by Dr Eisenberg about 3 years ago, and the idea was to people to learn about the problems and to associate with each other, and also to share some of the problems that you have. And from that group of 4 of us volunteered, and we formed a little party, and we've been going 3 years now, purely as a social effort. And at a social, you get people can talk to each other. They don't always talk about their problems, but in fact the opportunity is to talk and to learn about what you can do about the things that are affecting yourself, your lifestyle and your body. So it's been very effective.
When I found out after the operation and through the hospital, of the support groups that they knew about. I've made it one of my goals to get involved with those groups. You don't have to worry about not being able to eat what's there because everybody that's there has been through it. So the food is more or less geared to your ability to be able to eat, which is one of the big issues that makes a big change in your life, how and what you can eat. And everybody understands it at those groups. And I would recommend both of those support groups to anyone going through this process.
It's important for people to be able to meet others who've had this problem. It sort of explains that you're not alone in this thing, and you also have a chance, opportunity to judge your own problems, dare I say, with the problem of others, and some are better and some are worse. But there's never any feeling of why me or anything like that. It never seems to arise at all. Nobody says, why me? They just accept it and just come to the social aspects of it.
There is a gentleman that goes to one of those groups, and he's had the mirror of what I've had. He's 5 years down the track, and I can see the scars are still there. The issues are still there, in a smaller way, if you like. You learn to adapt, you learn to change, and the things that concern me at the moment, he's been through, he knows it, and he's living his life to the full.
I've got a thing to know that there's other people, that you're not alone, that there are other people that you can help overcome it. After 39 years, I feel that I have helped so many people through their tough times can know that there is a light at the end of the tunnel, that you can survive.
Right, so just before we wrap up and head for lunch, I'd like to welcome to the stage Andy. Andy was diagnosed with left tonsil squamous cell carcinoma in 2018. With his contemporary dancing background, he will be telling us about a creative piece he's been working on called 123 Days. Welcome to the stage, Andy.
30 years ago, my mum was diagnosed with throat cancer. Dundee Hospital, 9 Wells. I get a call, go to her, ask the doctor 1 to 5, 4. The shock, the emotion, the suddenly understanding what throat cancer was. They took out a golf ball size lump from her throat. 99% caused of smoking. It's a Scottish way of life. This is an international part of the show. But what was interesting was that I completely went into the mode of looking after my mum. I painted her house, we sold it, moved her in beside my sister, and she's now doing really well. She's fantastic at karaoke. Her best one is funky cow. She does it brilliantly, like it's brilliant, like really great. And she's just happy. 2016, 17, I was working with Emma O'Brien, and I was working in the Royal Melbourne Hospital doing hand hygiene dance. And then suddenly this lump appears on my neck. And it doesn't affect me. I was still dancing away, enjoying myself. Actually, it gave me a lot more energy. I was actually different, and it didn't affect my fruit or my intake. In fact, I started to lose weight. That was the best part. I thought, oh wow, look at this. As a dancer, you always want to lose weight. And then it got bigger and bigger. And I went to the doctor. Sounded a bit like really Connolly there. I went to the doctor. And I said, got a lump on his neck, you can tell you got a lump on your neck. He had said to me, I think it's got to do with your driving. Sometimes you get your window down. And I went, okay, it's the driving. But I don't drive, so that was it. And then my Vietnamese hairdresser in Footscray, he took me to a Chinese herbalist. And I had brown stuff, and I had to drink this. And suddenly I was in a spa pool, as you are in 2018 in Adelaide. And a friend of mine, a doctor, sat opposite me. And he said, Andy, you know, get that checked out. That looks like cancer. And even now, the sensation that goes through your body as a dancer, when that word comes out, was such, it knocked me for six. And so I went to the hospital, Peter Mac, and 13th of February, I was diagnosed with cancer of the tonsils. If Mum had taken it out when I was small, I might have been fine. Anyway, I decided there and then that every day throughout this process, I would make something. I would do something that was me. I'm a dancer. Always have been. Always been a fantastic dancer, danced all over the world, had great times. So I decided that there and then, that every day, for 123 days, from the beginning of being told I had cancer until the end of the radiation, I would make a dance. No matter what state I was in, no matter how much morphine I had, no matter where I was, I would make a thing. The first one, on the 13th of February, goes like this. That was because in 6 hours on that day, I might have found out it had gone below my neck, and I might not have been here in front of you telling me the story. And then as it progressed, I made different gestures every day. This was getting the mask fitted. This is for the dentist. I got that one recruiting quite appropriately. This was the getting blood, which side do you want to do it? And then I started off this was telling my boys I have cancer. This was a scan. This was the chemo going into my body. This was the steroids attacking me. I hated the steroids. They made me really aggressive, like I could take on the world. And then I was at the bottom. And then some of the gestures got really disturbing as the pain grew in. And they were quite hard to fathom out what they were about. The journey over the 123 days was fascinating to me. It started off with the complete and utter shock of being in that moment of finding out. And then there was a realization that I had to get through this pain somehow. And then the chemo blips happened. And they were like a surge going through my body. And then the calmness down and then back again. And then the relentless pounding against my body of the radiation started to take its toll. that one there, sorry about the unitard, that one there really became a theme, a motif, we call it in dance. And I used to figure out how I could move with it, and how just one arm could use it. The next one was real the pain, like completely and utterly at your lowest. So it kind of became an emotional, physical, human diary of my life. If you go to the next slide, I do think we have to raise awareness. I mean, no one has ever heard, certainly not in my life I knew, about tonsil, having a cancer on the tonsil. We're working towards a piece, myself and Emma, and a cellist called Lora. Emma will be doing the vocals. I won't be singing, a cellist and me. We want it to be provocative, we want it to be stimulating, and we also want you to feel something. Because I have to say, I certainly feel something when I'm dancing some of those gestures. When I do, we did a little presentation of it in the other hospital, the Park Land, the Park View. And I was just dancing away with all these gestures like you do as a dancer. And then suddenly, I made a gesture. And there I was, back in the hospital, and I broke down. Like I absolutely felt the Peter Mac around me. I felt the shock, the bewilderment, the pain, the loss of knowing what I was doing. Would I get through it, or would I not? So they actually still mean a lot to me. I would love to do workshops and more people to understand it, and put your hands out. Come on, this is the only one I'm going to teach you. Shake one hand. That's good. Shake the other hand. That's not the thing. Put one hand in the nose. Put the other hand on your ear. This is called coordination. Like a flag the other side. Whoops, daisy. You see? That's it. You being a dancer and you know, I can do it with a tongue. You can even poke your eyes out. Anyway, we've done, thanks to the Royal Melbourne Hospital, we went to the hospital place and we took 123 photos of me going through the dance, snap, 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 and they're kind of like a visual diary of it all. We're working towards a submission. You have to get paid, I suppose, part of life. You have to look after your toothpaste, you have to move forward. And we want to take it to festivals, events, and things have changed in my body. As a dancer, I've known it since I was 14. Well, I knew it before that, but I didn't really know it. And I know what's amazing, it changes, is my mouth. Like, I used to shout a lot, and I can barely get my thumb, and it hurts. Yeah. My neck, really fantastic on this side. This side, it barely gets to there. Every day I'm doing exercises. This hand, glorious. This hand, not so good. Can you see the difference? It's quite shocking. If you're in front of a mirror teaching kids and they're all copying you like that, it's quite strange. And I was teaching a bunch of boys. I do lots of boys classes. And I had the feeding tube up my nose, as you do in a dance class. And because I kept dancing, I kept making these gestures. I still wanted to be fit, I didn't want it to beat me. And I opened the door, and these 5 boys come in. And I had no hair, well not much anyway, but I had no hair, no eyebrows. And I said, hi guys, I'm going to a dance class. I said, I've got a bit of a problem. I've got cancer and I'm getting fed through a tube. One of the boys says, I've got a sore foot as well, sir. That's a good one, that'll bring it through. So, 123 days, 123 gestures, all inspired by cancer. So, I'm probably a cancer dancer.
All right, thank you very much to Andy and also Emma for being here today. So without much further ado, I'd like to thank each and every one of you for taking the time to join us today and to be part of this head and neck cancer event.